This is me Arzu here, and I welcome you to my channel Mr. Teeth, where your dental concept get dissected. So this is our first video of the dentin in the Dental Histology Series, and as you know that I was uploading the video of dental cement, which is of dental materials previously. So the some few topics of that chapter is left still. Okay, so I will cover those topics in few days, but for today I will start with the new chapter, that is dentin. So without delaying much, let's get started. So the content of this video, okay, so just for this video, okay, we will be discussing with the introduction to the dentin, what is it, okay, we will understand that. Similarly, the physical and the chemical properties of the dentin and the composition of the dentin. Similarly, the types of the dentin also we will discuss in this video. So the first section is introduction to the dentin. So in this first section of this today's video, so dentin is a mineralized hard tissue that forms the bulk of the tooth. I think everyone knows this. Okay, so it is a one of the mineralized hard tissue that forms the bulk of the tooth. So in this figure I want to show you that. Okay, so this green that I have colored with the green, okay, so this portion of the tooth is enamel. Similarly, the portion of the tooth that is beneath this enamel is the dentin, okay, and the portion of the tooth that is beneath this dentin is the pulp. Okay, so this green line is separating the dentin with the pulp. So seen using the light microscope on the ground section or the decalcified section. Okay, so dentin is seen itself. Okay, so it is seen using light microscope itself. Okay, so we can see it in a light microscope in ground sections or the decalcified sections. Similarly, the dentin is harder than the bone or the cementum, but softer than the enamel. Okay, so as I have discussed in the enamel video, okay, so there I have told enamel is a hardest substance, okay, hardest substance of our body. Okay, but the dentin is harder than the bone and the cementum, but softer than the enamel. Okay, so it is bit softer than the enamel but harder than the bone and the cementum. So it is very important, it is basic concept that you should know. After that, I have written here 2 points. Okay, so in the permanent tooth, the dentin that is present in the permanent tooth have the harder dentin than that is present in the, okay, primary tooth. So the dentin is harder in the permanent tooth. After that, it is hard at the central part of the tooth than at the periphery. Okay, so in this picture I want to show this thing. Okay, so this is a central portion of the dentin, and this is in this central portion of the dentin there is a harder, okay, so there is a harder dentin in comparison to the dentin that is present here in the periphery side. Okay, so as the dentin is present here also, it's in periphery, and also the dentin is present near the pulp. Okay, so those dentin that is present near the pulp or those dentin that is present near the enamel, in comparison to both the dentin, the central part of the dentin is bit harder. So just remember those 2 points. After that, I have written here it is formed slightly before the enamel. Okay, so when I will discuss with the odontogenesis, there I will discuss this point clearly. Okay, so there we will discuss that dentin forms earlier than the enamel. Okay, so after that it continues to form throughout the life. Okay, so unlike the enamel, okay, so enamel can't be formed. Okay, once it is formed, if it is destroyed or altered, okay, so it can't be formed again. But dentin is a living tissue. Okay, it is not a substance, so it is formed throughout the life. It is written here. Okay, so physically and chemically it is resembling with the bone, but have one morphological difference with that of the bone. Okay, so that one morphological difference is that, okay, so dentin, so the living tissue that is dentin contain the odontoblastic processes of the odontoblastic cells. Okay, but bone don't have any sort of those processes. Okay, as I have, okay, as we know that in dentin there is a presence of the odontoblast. Okay, so odontoblast is present here. Okay, odontoblast is present in the pulp region, and it gives the odontoblastic processes. Okay, so this is odontoblast and this gives the odontoblastic processes. So this is odontoblast that is present in the pulp and give the odontoblastic processes that is present in the dentin. Okay, and this odontoblastic processes run in the dentinal tubules that is present in the dentin. But in bone there is no any sort of these processes. Okay, there is no any kind of processes present in the bone. So morphologically, in that sense, bone is different from that dentin. And in this picture, as I have discussed, so it is harder at the central part of the tooth than at periphery. Okay, so just remember this. After that, okay, so before telling about the physical and the chemical properties, I will show you one picture. Okay, so as you can see here, okay, so in this picture you can clearly see this yellowish color thing. Okay, so there is presence of the yellowish color thing. Okay, so this is yellowish color. Okay, so and this white color is the enamel, and this yellowish color thing that is present beneath this white color enamel is the dentin. Okay, so it is dentin here. After that, okay, so in this we can see here. Okay, so this is a enamel and dentin junction. Okay, so it is labeled here, enamel and dentin junction is it is. Okay, after that, direction of the growth of the dentin. So growth of the dentin is towards the pulp, and this is a cementum and dentin junction. So cementum and dentin is it meet at this junction. Cemento enamel junction is also present there, and the cementum and dentin junction is also present here. Okay, so this is cementum and dentin junction. And similarly, here is a odontoblast. Okay, so it is odontoblastic layer, that is a layer of the pulp, and that odontoblast is giving the processes that is running in the dentin. Okay, so it is very clear image. You can clear your concept by this picture. Okay, so this is odontoblast, this is dentinal tubules. Okay, so S-shaped dentinal tubules are present in the dentin. Okay, so I will discussing with the dentinal tubules in later videos, but for now you just think odontoblastic processes run in dentinal tubules. After this, okay, so I have also this picture. This is a picture of the odontogenesis. So during the process of tooth development, so this is a enamel. Okay, so this dark pinkish color, okay, dark pinkish color that is present. Okay, it is labeled here, it is enamel. Beneath that there is a dentin, and this is odontoblast. Okay, so this is odontoblast here, and above this enamel there is a ameloblast present. Okay, so you will be cleared, okay, in these concepts, okay, in my odontogenesis video. Okay, so just stay tuned for that video. But for now, as we are in dentin, so let's discuss about this. So in physical and chemical properties of the dentin, it is yellowish in the young and gets darker with the age. Okay, so it gets darker with the age, and it is resilient and elastic, prevents the fracture of overlying brittle enamel. It is easy to understand as the enamel is brittle, so that the dentin, which is resilient and elastic, it prevents the fracture of that brittle enamel. After that, it is more permeable than the enamel. Okay, it is more permeable than that of the enamel. As I have discussed in my enamel video, enamel was semi-permeable there. Okay, so it was a semi-permeable, and is quite more permeable than that of the enamel, and it have greater compressive and the tensile and the flexural strength than the enamel. Okay, so compressive, tensile and the flexural strength, all those three types of strength are greater in the dentin than that of the enamel. So you should remember this also. After that, in radio opacity, so cementum and the bone have similar kind of radio opacity. Okay, cementum and the bone have similar radio opacity, but when we will compare the portions of the tooth, enamel, dentin and the pulp, so they are in decreasing order as we move from the outer surface towards the inner surface. Okay, so there is decreasing in the radio opacity. So enamel, dentin and the pulp cavity is here, and the density of the dentin is 2.1 gram per mm cube. Okay, so this is data that you can remember. After that, in composition section, so in composition, it constitutes of inorganic portion and the organic portion plus water. Okay, so in organic portion there is water. Okay, so there is water here, and that is 35%, and in organic portion there is 65%. So when you will compare the composition of the enamel and the dentin, so enamel there was larger proportion of the inorganic materials. Okay, so and in comparison to the organic material, but here it is a little more organic content is present in this dentin in comparison to that of the enamel. So what is present in the inorganic section? Okay, so in inorganic section, it also constitutes the hydroxyapatite crystals composed of the several thousand unit cells, and the formula of the unit cells. Okay, so that is Ca10PO4 6 OH whole 2. Okay, so this is a hydroxyapatite crystal is present there, that is similar with that of the enamel. So hydroxyapatite crystals was also present in the enamel, and here also there is a presence of the hydroxyapatite crystal, and it constitute of this different unit cell. Okay, so crystals are formed by several thousand unit cells. Okay, and that crystals, okay, how it differ from that than the crystals of the enamel is that, okay, so the crystals of the dentin are the plate shaped. Okay, so just remember this distinguishing feature is this. Okay, so it is a plate shaped in the dentin, and it is much smaller than the crystals of the enamel. So just you should think about this point. Okay, so there is much smaller crystals than the enamel, and it is plate shaped. After that, there is a poor in calcium content but rich in the carbon content than the enamel. Okay, so you should remember this also. So in dentin, the hydroxyapatite crystal that is present in the dentin would have larger, okay, poorer calcium content, okay, but it is higher in the enamel, but it is rich in a carbon content. Okay, so as there is presence of the more organic constituent, okay, so from that you can remember that as organic constituent is present higher in the dentin, so that there is a presence of the more large number of the carbon content than the enamel. Similarly, phosphates, phosphates and bicarbonates are also present in the enamel, dentin, sorry. Okay, after that, as we have completed the inorganic section of this dentin, in organic section, okay, so there is a 35% of the organic constituent in the dentin, and what is it, what is there present is that, okay, so collagen fibrils are embedded in the ground substance of the mucopolysaccharide. Okay, so there is a mucopolysaccharide that is a ground substance, and in that ground substance there is a presence of the collagen fibrils. Okay, so collagen fibers are present there, and which collagen fiber is present there is, then we should tell. Okay, so type 1 collagen is the present in the organic portion of the dentin. Okay, so it is present, it is a principal type of the collagen in this dentin. Also small amount of the type 3 and the type 5, okay, collagen are also present there. Okay, so just remember this type 1 collagen, that is 90%, and it is a principal type of the collagen present in the dentin, but type 3 and the type 5 collagen are also present in the dentin itself. And the important constituent of the ground substance, okay, so as I have told you, ground substance, it contains the mucopolysaccharide. Okay, so the important constituents of the ground substance are the proteoglycans, phosphoprotein, glycoprotein, and the phospholipids. Okay, so in proteoglycan section, okay, so it have chondroitin sulfate, decorin, and biglycan are present. Okay, so which comes under the category of proteoglycan, so they are a proteoglycan and they are present in the ground section of the dentin. Similarly, dentin phosphoprotein, DPP, okay, so this is very important here, and gamma carboxyglutamate. Okay, so this is glutamate here, and containing the protein that is called GLA protein. Okay, so this GLA protein and dentin phosphoprotein, they are the phosphoprotein actually, and they are present in the dentin. Similarly, the glycoprotein is here. So in the glycoprotein we have dentin sialoprotein, that is DSP, osteonectin, and the osteopontin is present here. So this dentin sialoprotein from here and dentin phosphoprotein is important. You should remember this osteonectin, osteopontin are also a glycoprotein that is present in dentin, and they are also important. After that, in a phospholipid, okay, so phospholipids, different kind of phospholipids are also present in this dentin. So what I have told you is that, so there is a presence of the proteoglycans, phosphoproteins, phospholipids, and the glycoproteins. And okay, so just remember chondroitin sulfate, decorin, biglycan from proteoglycans, dentin sialoprotein, dentin phosphoprotein from phosphoprotein, GLA protein and phosphoprotein. Okay, so just remember those. Okay, after that I have written here dentin sialoprotein and dentin phosphoprotein are present only in the dentin, not in the bone. Okay, so this is a very important, as I have discussed earlier here. Okay, what I have told here is that the dentin and the bone, they are physically and the chemically resembling with each other, but there is one morphological difference, and the morphological difference was this odontoblastic processes. Okay, but also sometimes a little difference is also present here. Okay, so that is DSP and DPP, dentin sialoprotein, that is a glycoprotein, and dentin phosphoprotein, that is a phosphoprotein that is present in the ground substance of the dentin. And also there is also ground section in the ground substance present in the bone too. Okay, so there is absence of this DSP and DPP. You can remember this is a very important for the MCQ. After that, in non-collagenous matrix protein regulates the mineral deposition and can act as a inhibitor, promoter and or stabilizer. So these non-collagenous matrix proteins, okay, so the proteins that are present, so these things, okay, dentin protein, dentin phosphoprotein, GLA protein, okay, so they regulate the mineral deposition, okay, and can act as an inhibitor or can act as a promoter or can act as a stabilizer. So all those functions can be carried out by those proteins, okay. After that, additionally, okay, so this is very important, additionally in the dentin, but it was not there in enamel, okay, so additionally in dentin only, okay, so in matrix content, so ground substance contain those growth factors, okay, so they are chemical like structures. So growth factors, transforming growth factor, that is TGF, okay, fibroblast growth factor FGF, insulin like growth factor IGF, bone morphogenic protein BMPs, okay. So insulin like growth factor is bit similar to that of the insulin, okay, when you will study the endocrine portion, okay, and in that endocrine portion when you will study about the insulin, okay, so there you will see about this IGF, okay, so IGF-1 and IGF-2 is present there, okay. So I will not discuss with that a lot here, but just I will recite here, okay. So inside insulin like growth factor is also present there, epidermal growth factor, okay, so platelet derived growth factor is there, vascular endothelial growth factor VEGF is there, angiogenic growth factor, that is AGF is there, okay. So those kinds of growth factors, okay, and they are regulating the growth and different kinds of chemical processes happening in the dentin, okay. So they are just like a hormones, okay, so they are similar with that of the hormones, so they are present in the dentin matrix. Now our last section of today's video is the type of the dentin, okay, and it is the largest topic of today's video. So in the types of the dentin, we have proper based on the time of the formation, okay. So in this histology, okay, so we will discuss with those types of the dentin, and also in our conservative we can study about the infective and affected dentin also, okay. So but just for here in oral histology, okay, so the this much classification is more than enough, okay, but when we will discuss with the conservative portion, okay, in our conservative subject, there I will discuss with the infected and the affected dentin, okay. So for now, for this video we will just discuss with those points: primary dentin, secondary dentin and the tertiary dentin. So primary dentin also it is classified further into the mantle dentin and cicumpulpal dentin, and it is based on the time of formation of the dentin, okay. So primary dentin, secondary dentin and tertiary dentin. So I want to show you one picture, okay. So in this picture, so as you can see in this picture, okay, so this is a chronology of the permanent teeth, okay. So you may be wondering that this is oral histology video, okay, dental histology video of the dentin, and I am showing you the chronology of the permanent teeth, okay. So the reason behind is this, okay, is that is the first evidence of the calcification, okay. So I want to tell you that, okay, so we can see the months, okay, in those months there is a first evidence of the calcification, and the root completion years is also present there, and there is a crown completion and the eruption date is also there, okay. So here, so the first evidence of the calcification of the first central incisory is the 3 to 4 months, and the root completion is in 10 years, okay. So the time duration from this first evidence of the calcification to the time duration of this root completion, okay, so from this 3 to 4 months to 10 years. So in this time duration, if there is a formation of the dentin, then that dentin is called primary dentin. So I want to clear your concepts, so I have shown you this picture. Similarly, if you can see this I2, okay, that is a lateral incisor, then you can see here it is first evidence of calcification is present in 10 to 12 months, but in a root completion it is 11 years. So the time duration between this, okay, and in this time duration if there is formation of any kind of dentin, then it is a primary dentin. And okay, so now in the secondary dentin, okay, so as I have written here, okay, so this is a root completion date, okay. So in this 10 years or in this 11 years, okay, there will be proper completion of the root, okay. After the completion of the root formation to the till the death of the tooth, okay, to the death of the tooth, I am telling throughout the life, okay. So the dentin that is formed is the secondary dentin. So just remember, okay, what is the primary dentin and what is secondary dentin. So the first evidence of calcification to the root eruption is the primary dentin, and from the root eruption, okay, so the year after the root eruption, sorry, by root completion, okay, formation of the root. So the formation of the root to throughout the life, okay, if there is formation of the dentin, then it is a secondary dentin. So don't get confused. And this tertiary dentin is a sort of type of this secondary dentin, but it is formed in certain stimuli, okay. If you have a caries present in our tooth, or you have any kind of trauma present in our tooth, then in such cases tertiary dentin is formed, and it is a bit similar, okay, it is a type of the secondary dentin, we can say. So in primary dentin, it is also classified into the further mantle dentin and circumpulpal dentin, okay, and formed prior to the root completion. So I have prepared the proper table of this mantle dentin and the circumpulpal dentin, and I will show you the pictures too, okay, I have prepared here. So in mantle dentin, first I will discuss with those points. So in mantle dentin, it is first formed dentin that is underlying the dentino-enamel junction, and it is soft, thus provide the cushioning effect to the tooth, okay. And the lateral circumpulpal dentin is a lateral formed and forms the bulk of the tooth. So mantle dentin, it is a first formed dentin, okay. So we can say that it is first formed dentin or a primary dentin, first form primary dentin or first form overall dentin itself. So it is a first form dentin that is underlying the dentino-enamel junction, so just below the dentino-enamel junction, okay. So just think, as I will draw here one picture. So if it is a tooth, okay, and okay, so okay, so this is a enamel, okay, and this is a dentino-enamel junction. This is a DEJ, dentino-enamel junction. So okay, I will show you by another pen. So the dentin that is present this just beneath this dentino-enamel junction, so that dentin is called mantle dentin, and it is a first form dentin, and circumpulpal dentin is beneath that mantle dentin, and it is later form dentin, and it forms the bulk of the tooth. Similarly, in another point, as I have written here, it is outer and the most peripheral part of the primary dentin, and it is 20 micrometer wide. So the width of this, okay, mantle dentin that is in the peripheral portion is the 20 micrometer, and the collagen fibrils are perpendicular to the dentino-enamel junction. So at this portion, okay, so here in mantle dentin, the collagen fibers are running in a perpendicular fashion, okay. So they run perpendicular to the dentino-enamel junction towards the mantle dentin, okay. So they run perpendicularly in this mantle dentin to the dentino-enamel junction. So it is easy to understand, and the thickness is 20 micrometer. You should remember those data, okay. Collagen fibers are perpendicular to the dentino-enamel junction, and larger collagen fibers, that is 0.1 to 0.2 micrometer in diameter, are organophilic, silver stained, and are known as a bone corpse fiber. So what this point wants to tell us that, so the collagen fibers that is present in this mantle dentin are of larger diameter, that is of 0.1 to 0.2 micrometer, and they are silver stained, so called organophilic, and those fibers are called bone corpse fiber, and those fibers are called bone corpse fiber. Similarly, smaller collagen fibers are also present in the circumpulpal dentin, and the diameter is 0.05 micrometer in diameter. So the dentin that is present, okay, so the dentin that is present beneath this mantle dentin, but a primary dentin itself, so in that also there is a collagen fiber, and it is of the smaller diameter, that is 0.05 micrometer, and is closely packed. After that, in type 3 collagen, so in type 3 collagen, as I have written here, type 3 collagen is present in the mantle dentin, and type 1 and type 2 collagen is present here, okay. So it is less mineralized in mantle dentin, and it is more mineralized in the circumpulpal dentin, okay. You should remember this. It is less mineralized here, it is more mineralized here, it have fewer defects, and it have more defects here in circumpulpal dentin. And the type of mineralization that is present in the mantle dentin is the globular dentin, and the type of mineralization that is present in the circumpulpal dentin is a globular or the linear pattern of the mineralization is present here. So that, okay, as there is presence of this more defect, and here it is a fewer defect, okay. So there is a larger number of interglobular dentin, okay. So I will be discussing with the interglobular dentin in later videos. So it is one of the defect that is formed due to this globular mineralization. Okay, so when the globules of the mineral vesicles, okay, mineral vesicles, when they fuse and small spaces between those globules are left behind, and that is not mineralized, so that forms the interglobular dentin. I will be discussing with that in my later videos. For now, just remember, more defects are present in the circumpulpal dentin and less defects are present in the mantle dentin. And for this I have one picture, I think. Okay, so okay, let's see this picture now itself. So okay, as I have shown, as it is shown here in enamel. Okay, so this is a enamel, white color portion is the enamel. After that, okay, after this, okay, so this brownish pattern, so this brownish pattern of this dentin, okay, so that is just similar like a narrow band. Okay, so it is like a narrow band. So this is a mantle dentin, and beneath that, okay, so this light brown, okay, so light brown color, it is a primary dentin, and beneath that too there is a secondary dentin, that is a pink color. Okay, slightly pink color, and beneath that there is a white color, that is a predentin. So I will be discussing with this predentin too. Okay, so this is very important. So predentin, secondary dentin, and primary dentin, so you should know the difference between them. Okay, so primary dentin forms the bulk. Okay, circumpulpal dentin is this, circumpulpal dentin is this, and this mantle dentin, this brownish. Okay, and this is a pulp, this is a cementum, and the secondary dentin is here, and the predentin is also present here. Now in the secondary dentin portion, so in the secondary dentin, it is formed after the root completion. Okay, so it is formed after the root completion, and it is a narrow band bordering the pulp, okay, containing the fewer tubules than the primary dentin. So as I have shown here in this pink color portion, okay, so this pink color portion is that is present here, it is a secondary dentin, and it is a narrow band like. Okay, so that is little smaller than that of the mantle dentin too. Okay, so just remember that it is a narrow band bordering the pulp, contain the fewer tubules than the primary dentin. Okay, so fewer tubules are present there in primary dentin. After that, bend is present in the tubules when the primary and secondary dentin interface. So this point wants to tell us that, okay, so if this is a tooth, okay, so if this is a dentin enamel junction, and just think how to draw this. Okay, I'll take few minutes. So this is a, okay, so the thing, this is a pulp, and this is a pulp, and this is a dentin. Okay, and this is a junction between the pulp and the dentin. Okay, so as I have told here in secondary dentin, so the secondary dentin is present just above this junction of pulp and the dentin. So in this junction there is a presence of the secondary dentin, and the tubules that is present in this secondary dentin. Okay, so tubules that is present in the secondary dentin, there is a presence of the bend between the tubules of the primary and the secondary dentin. So the tubules are present here also. Okay, and the tubules, so in this picture it is not clear, but I mean to say that, okay, just think, so if this is a secondary dentin, okay, so if this is a secondary dentin, and it is S-shaped tubule is also present there, and this is a primary dentin, so there is a sort of a bend present. Okay, sort of a bend present in the tubules where the primary and the secondary dentin interface. After that, it is formed more slowly than the primary dentin, that is of 1 micron per day, not formed uniformly. It is formed more slowly. It appears in a greater amount on the roof of the roof and the floor of the coronal pulp chamber, where it protects the pulp from the exposure in the older tooth. Okay, so what it means is that secondary dentin, so if it is a, this white color portion is a pulp. Okay, so in the roof, so in the roof portion, so in the roof portion of this white color pulp, and in the floor portion of this white color pulp, there is a larger amount of the secondary dentin, and this is due to, this is a one sort of adaptation that protects the pulp from the exposure to the older teeth, and it is not formed in a response to any kind of the external stimuli, and the ratio of the inorganic to the organic material is similar to that of the primary dentin. So the ratio that is of inorganic to the organic material is similar to the primary dentin. After that, histologically, subtle demarcation line is present between the primary and the secondary dentin, and less organic of the less organized. Okay, so this is organized here, less organized of the dental tubules than the primary dentin. Okay, so histologically there is a subtle demarcation line, and also as I have told here that it is that there is a presence of the bend. Okay, there is a presence of the bend in the tubules when the primary and the secondary dentin interface. So when there is interference, so when the junction is formed between the primary and secondary dentin, there is a formation of the bend in the tubules. Similarly, the histological properties of the secondary and this primary dentin is different, so that there is a presence of the subtle demarcation line is present there. Okay, so subtle demarcation line is present between the primary and the secondary dentin. After that, in tertiary dentin, tertiary dentin is a type of the secondary dentin as it is formed after the root completion. So it is also called as the reactive or reparative dentin, or defensive dentin, adventitious dentin, replacement dentin, irritational dentin. Okay, so they are the synonyms of the tertiary dentin. After that, it is produced in the reaction to the various stimuli. It is produced in the reaction to the various stimuli. As I have discussed earlier, it is produced only by those cells that are directly affected by the stimulus, and quality and the quantity depends upon the intensity of the duration of the stimulus. So this is important to understand here. Okay, so what is the intensity and what is the duration of the stimuli? That depends the quality and the quantity of the tertiary dentin formation. And there is it shows the irregularity in the number, size and arrangement of the tubules due to the rapidity in its formation. Okay, it shows irregularity in the number, size and arrangement of the tubules due to the rapidity in its formation. Okay, so as the tertiary dentin is formed bit faster, okay, it is formed bit faster than that of the secondary or the primary dentin, so there is a formation of the, okay, so there is a irregularity present there. Okay, so there is a formation of the irregular dentin tubules. Okay, so irregular dentinal tubules are present more in this tertiary dentin. And as I have here told, okay, so there is a less organized dentinal tubules than the primary. So you can just make this ascending order. Okay, primary, then secondary, and then tertiary. Okay, so the organization of this dentinal tubule, so it goes in this order. Okay, so primary there is more organized dentinal tubule, in secondary there is less organized dentinal tubule, and in tertiary there is very irregular dentinal tubules arrangement. After that, tertiary dentin also it have two types of the dentin. One is reactionary dentin and another is a reparative dentin. And in reactionary dentin, it is formed due to the mild and moderate stimuli like the slow carries, and in reparative dentin it is formed by the aggressive stimuli like the deep caries, trauma and the cavity preparation. So you can just understand that point. After that, it is formed by existing odontoblast, and it is formed by the newly differentiated odontoblast like the cell. Okay, so this is very important to understand here. What it means is that, so as I have told, reactionary dentin and the reparative dentin. So the name suggests us that reactionary means if anything is happening, okay, if anything is happening, you will just react to that condition or to that stimuli. So that is just reactionary dentin. But in reparative dentin, the stimuli is that much severe. Okay, it is that much severe, it is highly severe that it destroys your odontoblast. Okay, so that you can't just react. Okay, so the stimuli is very severe that you can react, but you get died. Okay, in that condition, and again you rebirth, and after that, after rebirth, you just give the reaction. So here is the severe stimuli present, here is the moderate stimuli present here. So reactionary dentin and reparative dentin, and so that here the existing odontoblast form this reactionary dentin, and here newly differentiated odontoblast like cell forms the reparative dentin. After that, in reactionary dentin, there is a slow formation, regular in structure, rapid formation, irregular in structure. Okay, so as reactionary dentin, it is formed by the existing odontoblast, there is a slow formation and regular in structure, and in rapid formation and irregular in structure. Odontoblasts survive the stimulus, die due to the stimulus, and better organized and properly mineralized, poorly organized and a variable mineralization is present there. So it is easy to understand. Now, as I have completed all those important points of today's video, okay, the topics that are to be covered in today's video, I have covered that. Okay, but I have missed the thing that I have, so I will show you on the pictures. Okay, so as you can see in this picture, okay, so I wanted to show you the tertiary dentin. So if there is a caries, okay, so if there is a caries, then there is a formation of this sclerotic dentin. I will be discussing this sclerotic dentin too. And there is a presence of the reparative or the tertiary reactive response dentin here. Okay, So it is just formed beneath the secondary dentin. Okay, so this is a predentin. Okay, so this is a predentin, and above that there is a this dotted line, there is this is a secondary dentin, and beneath that secondary dentin there is a reparative or the tertiary dentin. So you should remember this picture. After that I want to show you this picture. In this picture, as you can see here, this is a figure of the primary or secondary dentin, and this is a tertiary dentin. So in primary and secondary dentin, the dentinal tubules, okay, so odontoblastic processes that is present in the dentinal tubules are regular and are of the small size, okay, and they are not wide, okay, they are not wide. But in tertiary dentin, the dentinal odontoblastic processes are very wide and they are very sparse, okay, they are very wide, and also there is a irregular arrangement of those odontoblastic processes. But here it is a proper arrangement of the odontoblastic processes. So this is a schematic diagram showing the difference between the primary or the secondary dentin with the tertiary dentin. So there is a large amount of the disorganization present in the dentinal tubules odontoblastic processes. Okay, so I wanted to show you this picture. So as we have covered all those topics of today's video, and in this video we have covered okay, so those points we have covered. So introduction to the dentin we have covered in this video, physical and chemical properties we have discussed with it, composition of the dentin and types of the dentin. So today was the just overview to the dentin. Okay, so I gave the overview to you about the dentin. In our upcoming video we will be discussing with the many aspects of the dentin. Okay, we will be discussing with the histological features of the dentin. So for today, if you love this video, please do like, subscribe and share with your batchmate. Also hit the bell icon so that when I upload the new video of any chapter of this dentistry, you will get notified. Okay, so just hit the bell icon too, and I will catch you in the next video. Till then, stay happy, stay healthy, and tata, bye bye. Thank you.